Good afternoon, everyone, and welcome back to our ITCU webinar series. This week we have Jordan Fox from Careington. Careington is one of our preferred partners here at InTouch Credit Union, and you may have noticed a series that we've highlighted our partners a lot, and that's done by design because your InTouch Credit Union membership gets you additional perks and benefits that may or may not necessarily be tied just to banking products. So we have Jordan here today again from Careington. He will be driving us down the road on what Careington is, who he is as well, what they offer for our members, what the benefits are, and how it may be beneficial to you and your family. We will be taking questions throughout the webinar, so you can put them in the Q&A down there. We'll answer those at the end. And just a reminder that this is being recorded, so if you have to step away or you missed it, or you just enjoyed Jordan so much you want to listen to him again, this will be available later today or early tomorrow on our YouTube channel, ITCU Inspire. And without further ado, I will let Jordan take over.
All right, Josh, thank you so much for having me. It is a pleasure to be able to be here today and to show InTouch Credit Union members who we are at Careington. I'm going to go ahead and share my screen right here, and I'm going to begin my presentation. All right, so Careington and InTouch Credit Union. From the beginning, whenever we met, we knew that our main goal was to be able to provide our products to you members at the rates that we are able to do. And our products really are far-ranging in what we are able to accomplish and help in everyday life through health, wellness, lifestyle, and even financial. Affordable access, smarter savings, and healthier life. That's kind of how we brand ourselves. We have our main Careington Solutions Simplified branding. We have a Careington Benefit Solutions, and we even actually have a very small part in the UK called Monroe Sutton, where we do have another dental network as well. So who are we really at Careington? And at Careington, we really are one of the founding companies to do discount plan organization, and we are a leader in third-party administration as well. So we are headquartered in Frisco, Texas. If you have actually just driven up on the tollway in the Dallas area and you've driven off of Gaylord, you've probably seen our building. So we like to think we're nice and local to a lot of InTouch Credit Union members as well. We do have access to over 150 products, and we have become more of a benefit aggregator over the years. Starting back in 1979, whenever our founder, Dr. Martin Brinker, he was a dentist in the Dallas area. And he went to, it's a great story, actually. He went to the city of Dallas workers, saw they had no dental plan at the time, and said, hey, I'm going to give you all a card to come to my office. With this card, I'll give you a discount. So from there, it formed into the 20 million members that we are today. Looking back at our history, as I was showing, 1979 is when we first started. Several things throughout the years that have been going. We were actually the first licensed dental HMO in the state of Texas. Began bundling our dental products with other ancillary products, which is the space that we're in now, such as VSP Vision. And then back in 2018, I don't necessarily have this on here, but in 2018, we created our own telemedicine company as well called Dial Care. And that is one of our biggest drivers today. I'll leave this up for a second if anyone is interested on a little bit more of the history, especially back in 2009, whenever we founded Monroe Sutton. And in 2006, whenever we became our actual TPA, an insurance agency. So our values, simplicity is really at the heart of everything that we do. We want to create and make things simple. Solutions Simplified is kind of our slogan. It is what we go by because our goal is to make solutions, whether they're health, wellness, finance, or even just lifestyle, easier for you. The availability of our products is unparalleled with anybody. There are no waiting periods, and everyone is accepted. So everyone can use our products. Nobody is left out. We want to work on the affordability, usability, transparency, and accessibility in our products by creating fee schedules. The fee schedules, especially in our dental networks, make it to where you know what you're going to pay before you go have an appointment. Our mission really is that solutions-driven product offering. We want to provide solutions. We want to be your partner in finding those. If there's something that you don't think that can initially be done, we're typically there with any of our concierge services as well to be able to help provide those services. Everything is focused on individual health and well-being of people. And that is what we work on every day and aspire to help. So our main business is discount plans. So what is essentially a discount plan? Well, discount plans provide savings plans for members to control their healthcare spending, plan offerings with fee transparency and the fee schedules, as I described before, the 4 services: health, wellness, lifestyle, and financial. And saving, the most important differentiation is the savings and discount plans are not insurance. So we don't have to worry about the pitfalls that can come with some insurances. What our plans have the advantage over is they're completely nationwide. Does not matter what area of the country you're in, you're going to be able to find access. With the telemedicine, if you need to make a phone call in any state, even a couple territories such as Puerto Rico, we're going to be able to help you. They're flexible, easy to find dentists. You can go onto our website and find anywhere you want. Vision providers as well. Anyone can join, no exceptions. Everyone is able to do this. We do offer plans to employees as well. And because of the discount space that it's in, full-time, part-time, seasonal, contract, retiree. For you members, though, specifically at InTouch Credit Union, though, this plan was made specifically for you, with you in mind. So why discount healthcare over traditional? Well, while we don't recommend replacing this with traditional healthcare, we are able to help fill the gaps and change how you look and how you deal with your healthcare. Teeth are an essential part of healthcare, one that many people unfortunately neglect, especially due to rising costs. It's difficult to be engaged with a dentist too, especially whenever claims are having to go back and forth and some are automatically denied anyway. Having to continuously go back and forth and fight over those claims is really just a hassle. And that is why we have already pre-negotiated the actual fees that you are going to experience whenever you go to a dentist. People are experiencing fewer employee benefits these days. It's just an unfortunate reality of the benefit landscape. Everything is becoming more expensive. We want to bridge that gap and let people who don't traditionally have coverage be able to get something. Limitations, especially in the dental world, in the maximums on your dental care can be a huge hurdle to get over. Whether it's a $500 or $1,000 maximum, or you don't even have dental insurance or any coverage of that nature, we want to help go there. I know people who are the type that would like to get a actual cleaning 4 times a year. It's just what they do. There are no limitations on our product usage. If you want to get a cleaning with your dentist 4 times a year, as long as they say, yes, you can come into my office and get an appointment, you can do that. No limits on the usage. The cost transparency inside medicine has also been it has never really been great in the US. And it is difficult to be able to figure out what some certain costs are. That's the fee schedule promise, is you are able to see the cost on there. So the real comparison chart of discount versus insurance. You're not having to wait. Once you sign up for a plan, we can get you your member ID that same day. Your card will come in the mail once you order, but if you do call into our member services number, which we can show later, you will be able to get your member ID and make an appointment that same day. No forms and paperwork to fill out. Just simple signing up for the product, you're there. No age restrictions. The entire family can even get on this plan. Kids as well. As I said before, limits on use, there are none. You want to go to the dentist many times, if you need to call the doctor 10 times in a week, that is your availability. You can do that. I have definitely used our telemedicine service to call the same doctor a few times before for something I just forgot one extra question about. It's just what you can do on that. Cosmetic services are included in this too. You get a pure 20% flat discount on that as well, including braces. Many insurance plans offer nothing for cosmetic services. and these low membership fees. While dental premiums are going to be somewhere in the $40 to $50 range for families, we stay well below that, starting around the $15 range for these plans per month. So how are you able to actually get signed up for these savings? Well, it's fairly simple. One, you just sign up to be a Careington member. Any ITCU employee is going to be a help, especially Josh here. They're going to help you be able to get signed up. They're going to be able to guide you in the right direction for the link to be able to find the product. Once you have figured out what you're looking for and you've gotten the product, you can go onto Careington.com or any other provider searches that you need to, and you are going to be able to find a dentist, a optical provider, or any of the other products that you were signed up for easily just with your zip code. One thing I can recommend too is when you're going on there, it generally shows about 10 on your first glance. I recommend clicking on that advanced settings that we can show you later, and you can show up to 100 at a time. And trust me, you will need that because our provider network is very extensive. You can schedule your appointments with those participating providers. Just make sure to call them up. Say you're a Careington member. You can give them your member ID and you can get that appointment. Show your membership card at the time of service or your member ID if you don't happen to have one. Always feel free to call into us if you do need to get another card, and we can get that for you sent to the mail. Very easy. And then you save money. As simple as that. So I'm going to start with the actual products that you have access to as members. The number one is our POS Dental Network. This plan has typical savings of 20 to 50% on most dental procedures. However, as we can see in that sample dental savings, which this has the kind of the aggregate costs that are happening in Los Angeles, Orlando, Chicago, New York, typically the Dallas, Houston, San Antonio areas, we have very similar cost as well. Each area, it's typically a couple state area, does have their own fee schedule, but they all are fairly similar with only a little bit % difference in the cost. So for example, if we take a look at this in adult cleaning, if you go to a regular adult cleaning and a checkup for retail costs, that can go up to $200 sometimes from a dentist without any insurance. Or say you've already reached your maximum, but you just need something, you want that little extra cleaning. With our plan and this plan cost, we can get that at about $63. You're saving 52 to 58% on that cleaning and checkup. This is just a small sampling of what is actually inside of the product. And it is the same way that I just described in the previous slide. You get the plan, you go find a dentist, you go to the dentist, you pay, and you're done. We call that a fee-for-service network. Our best comparison, actually, funny enough, is to Costco. Whenever you sign up for a Costco membership, you get the card, you can go to Costco to get their discounts on their products. Of course, you're buying in bulk, but for us, it's the same way. You get our plan, you get the card, you go to our dentists, our optical providers, our telemedicine doctors, and you're able to get those discounts. As this is just a sampling of the products, the fee schedule that you're going to see if you look online, which they are publicly scheduled, so you can see them anytime you need to. You can just do a Google search for POS Dental Careington fee schedule on Google. We can provide links to that as well. It is going to be an extensive list of dental procedures with their associated dental codes as well. Everything is coded, so if a dentist puts your procedure at a certain code, we already know what that code is going to cost. Next product is the VSP Vision Savings Pass Vision Program. This one is a little bit more simple than the dental. There's not as many procedures that go on with your eyes, especially, there's not a cleaning versus an extraction versus a root canal. It's going to be one rate, that $50 for an eye exam, and you get discounts on contact lenses, glasses, and any other extras your vision provider is looking to offer you. There is even, if you're looking for LASIK or laser vision correction, there is discounts on that as well. It feels like almost every dental optometrist in the United States does take VSP, so you're going to have no problem at all finding one of these providers. Access development. This one is going to be more on the lifestyle side of our product bundle. You get discounts on hotel, car rental, recreation, dining, shopping, and automotive. So whenever you're looking for just that little bit extra discount on something that you're looking for, you're going to be able to find it with access development. It's an easy portal you can sign up and look on and figure out what are you going to be able to get that just a little extra. What are you going to be able to stretch your dollar just that little bit more for? And say you're going to the brick and mortar stores offered in this, you're going to need the roadside assistance to serve you as well. This roadside plan is unlike any you're going to be able to find at this price that we have for you. It is 4 services a year with up to $100 per incident. Say you want to take advantage of the upcoming summer and you want to do a road trip with your family, or you even just go to your local store and use Access Development. You are going to be able to get that coverage for towing, extraction, lockout, fuel delivery, tire changes, and jump starts. You are going to be able to use this product and have peace of mind whenever you are traveling with you and your family to be able to travel and have complete clarity and know whenever you go, you're going to be covered by roadside. Med impact. We cannot forget the prevalence of prescription drugs that are going on right now and everyone that needs them. With these discounts in there, we even find actually a lot of times, myself included, that these, especially from Med Impact right here, that these these RX prescription plans are able to get a better discount than what our insurance is able to provide. Now, depending on if you have a high deductible plan or not, that's for you and your insurance company to decide what's going to be better for you. But a lot of times, just the less cost on that prescription is going to be the key to saving money. Here is a small list of the participating pharmacies as well. As you can see, it's very extensive, including all of the big ones: Kroger, Walmart, Walgreens, CVS, and almost any other that you think you need. And more recently, my absolute favorite product that we've been able to create. As I was saying earlier, back in 2018, we decided enough is enough. We don't want to have to deal with any other telemedicine provider. We're going to make our own. We created our Dial Care network. We contract directly with the doctors, and you're going to have access to virtual vets as well. That will be coming in the new product bundle very shortly. But it is essentially call a doctor or a vet 24 hours a day for any issue you have, whether it be large or small. This is meant to be more of an urgent care type visit. So I have the sniffles. I think I have a sinus infection. I think I have a rash. You can get on the phone. You can do text, call, or video chat with a doctor 24 hours a day, and they can get you prescriptions, which you are going to be able to save money on with the RX plan as well. The telemedicine has no consultation cost. If you call, you are not going to pay that doctor a cent. It is covered in your membership fee. I know I myself have called Dial Care at this point countless times. It works in all 50 states. You can even travel with it in some territories and be covered as well and be able to get anything you need there. You can call for as simple as sniffles or as complicated as, what is this on me? Do I need to go to an urgent care, or is this something that can wait to go see my regular primary care physician the next days or weeks? That is what I got for you right now about the product bundle that is with In Touch Credit Union. Thank you so much. And I believe now, if there are any questions.
Hi, Jordan. So questions that I have from the presentation is, what is the difference from that Careington offers versus some of the other, mainstream, I'll call them, providers? So for example, you guys have a telehealth program.
Mhm.
How does that differ from, say, Teledoc or MD Live?
Of course. So the main difference is, number one, I like to think the family aspect and what we do plays a lot into it. We are still a individually owned company that we're easy to get in touch with. So we have that little bit more of a care put into the product. In terms of what's going to actually be different for the members too, finding a plan at the rates that we have that have no consultation costs, it is very difficult. So we have created this product bundle specifically for your members to be able to access them for prices they're not going to find anywhere else. During actually the peak of COVID, whenever telemedicine really expanded, we were still around the 5 to 10 minute range for being able to get a consultation. Our platform, I really like to think, is better. We're going to have very detailed histories of your appointments with these doctors. And it's saved. So you are, of course, everything HIPAA compliant, but saved into where you're going to be able to access your history. And you're going to be able to share that history and do whatever you need to with any doctor that you were talking to.
And follow up to that, Jordan. So would they, let's say they do have insurance as well, would they have to file on insurance and pay a copay fee through y'all's program, or could, if they have a Carrington membership and they use the dial position, would they have to pay any extra cost for their visit?
Great question. So this is actually something that comes up a lot. Whenever someone does have either employer or insurance sponsored telemedicine packages, there is typically, I would say the average cost of a copay is about $45. With this plan, it is $0 copay. The member is not paying an extra cent to talk to this doctor. Once their membership has been created and they get their account to sign in to the Dial Care platform, which it is web and app based, you are able to call and you don't have to worry about spending one extra dollar outside of your membership that you to talk to this doctor. There is no extra copays. You are not having to file this through your insurance. There's no filing at all required. And whenever you go to the pharmacy, if you can send it to your pharmacy of choice, and if your pharmacy of choice already has your insurance in there, they are able to look it up and get you either your reduced cost for your prescription, or you can always look at the med impact cost.
That was going to be my next question, but you already kind of covered that a little bit. And the reason I asked is because I was going to ask about the prescription questions. I had a recent incident like that where, normally I thought my healthcare plan, which does cover prescriptions, did, and come to find out, your healthcare plan may not cover all prescriptions. So while you can still have the prescription filled because a doctor prescribed it, yes, there's not your insurance will not help assist with any of the cost coverage. So before I really knew about Carrington, I used a different program to do that. So that was going to be my follow-up question.
Oh yeah, well,
Moving away
100%.
from healthcare, not dental care yet. We'll get there. But on the roadside assistance, so a lot of people tell me, "Oh, well, Josh or Mr. J, depending on if I'm talking to students or if I'm talking to adults, um, because for some reason they can't pronounce my last name, I like just call me Mr. J. It's easier. Uh, well, my insurance offers, roadside assistance for me, and that's included. And I said, well, yes, it is, and there's usually an upcharge for that service. But what is different about, say, the service Carrington provides that than the major insurance carriers? Because again, the question is, well, that's included, and I'm reading your slides here, and it looks like Carrington actually gives an allowance to. There's a bullet point that says the plant will pay up to $100 per incident. So
It
I'm going to
will.
call that an allowance.
Yes. So it actually is, I'm going to compare it a little bit to the telemedicine. It's very similar. Yes, you do have a roadside provider typically in a lot of your car insurances that they potentially bundle with. But there's going to be, similar to the copay, potentially an extra premium cost essentially. So you're going to call those and there is a cost associated with it. You do typically get a discount, but with ours specifically, you get 4 services a year with $100 starting allotments on each of those. So if you just need a jump and they're going to come over, jumps in almost all metro areas are under $100. I think averaging around the 50 to 75 range. You're not going to pay a dime on that as long as the shop that roadside has contracted with does not have a rate over that, which they should not. The great thing about them too is if you do have an issue, You just call up Roadside Protect, and they are able to schedule everything they need to help you, whether it be that tow, and anything that is over $100, would the member would be responsible for, but only if it's over $100. So say there is say you need to get towed a few miles, and the service in general would be 120. You're only paying $20 extra outside of any other costs. So it is going to be similar in terms of there's no initial copay. You got 4 free uses of that up to $100 each time. That is already a $400 value right there inside of it.
Thank you. We have a question popping up that says,
Sure.
this individual has Medishare coverage, which they think uses Carrington for dental and maybe vision.
Sure.
But does Carrington cover in-person medical doctor visits outside of telemedicine?
So at this time, we do not have any physical doctor appointment scheduling capabilities or that. This is going the telemedicine aspect of this is going to be 100% virtual. We definitely wanted to keep the kind of separation of your primary care doctor or your main insurance a little bit separated from us, so you can see the clear value in each of them differently. So and real person visits or real office visits, we do not do that at the moment. And actually bringing up, if you already do have a couple Careington products through any other insurance provider or Medishare that you have, this does not exclude you from being able to sign up for this as well. Even though it is a bundle, you are going to be able to get great value off of any of the products individually inside of this, whether it be the telemedicine and the roadside is all you're looking for. You're still going to not be able to find a pretty much essentially a bundle that is going to be a better value than for you In Touch Credit Union members than this. So no fear in doubling up on products. Say you do have one from your insurance. No fear at all. And if you have 2 of our dental networks, that is completely totally fine.
Thank you. So Jordan, correct me if I'm wrong, but because we get this question a lot, but you're the expert on the panel today. So a lot of people do ask us about the law around health insurance. So, there is a requirement now that you show you are covered with health insurance either through the government marketplace or your employer, or else there is a fine you pay. And for, I don't know the full name of the act, but it's commonly known as Obamacare. So with Carrington, because you other than the telehealth and the prescription, you don't really cover medical. But is the reason you guys offer these related healthcare products, because you're right, vision affects a lot of your health, your teeth affect. I mean, anybody who sat through a lecture on a doctor or a dentist visit or your eye doctor can say, well, this affects this, and I'm like, yeah, I know, I don't need the lecture. Save the breath. I know. Is because these aren't covered under that, where it's not a requirement to have those, and that's why I think you even said it earlier, people tend to forego vision and dental because there is the cost of purchasing that insurance on top of what you have to go already. So if they don't have to have it, they're more likely to not purchase it because that's an extra cost when they're trying to use their monies in a better way in their mind. Because if it's not required, I don't really need it, because I've got to worry more about food, shelter,
Yep.
transportation. So is that a fair question?
Yes, no, and you hit the nail on the head with that last point too. Is a lot of people do forego getting that. A lot of people call optical and dental ancillary products, which they are. You are not required to have dental insurance or eye insurance. It's just the way the market is. So these plans, and they are all in all our disclaimers, as well as I was describing the difference between us as discount and insurance. We are non-insurance. We do not meet. So I believe it's called the ACA minimum care requirements. We purposefully do not, because we do not want to be a replacement for traditional insurance. Now, dental and optical, we definitely can be a substitute. Since the care is going to be the care is going to be the same. It's just going to be the way and how much is paid for. So we are not going to be able to change. So I believe it's through your. I think we all just did them through our taxes that you have to list. Do I have health insurance?
Mhm.
So we're not going to change that status. You're not going to have to pay any extra taxes or announce it or anything. And for people, some of our biggest markets actually are people who we'll call underinsured. They either don't have access to dental or optical through their employer. They have to seek it on their own. Going for a marketplace dental plan is exceedingly expensive. And that is why we created these, so that people can get dental and optical care for a less price than they would be able to otherwise, or maybe not even be able to otherwise.
Thank you. And we do ask that because even though we at In Touch, we're in several markets, right? And there are certain parts of our markets where people think, oh, everybody who's in this area is doing fine. And well, we kind of find out that that's not really always the case. We don't know what's going on
Mhm.
behind closed doors. So that's a reason why we partner with people such as Carrington and our other partners because they provide services that are more budget friendly or
Yep.
wallet conscious, whatever you want to call it. While it's not free and all, we would love to be able to have enough assets and funds to do that for our members. It is a coverage at a lot of coverage at a discounted cost because again, they pay a flat fee for all of this. They don't
Correct.
pay, you know, whatever the cost for this and they only get medical. And if they want to add on another service, it's gonna, we're gonna charge you another whatever. And a fun fact, Jordan, that I actually discovered yesterday while preparing for the webinar is if our members sign up through our link,
Mhm.
instead of going straight to Carrington yourself, I discovered that the one-time processing fee is actually less if they sign up through us. I can
Yes,
I,
it's
and
only
I
$10 versus the typical 20.
Yep.
Mhm.
So I was like, I don't want to put you on the spot, but wanted to bring that up. That's another cost saving benefit is your processing fee is cut in half for ITCU members if they choose
Mhm.
to enroll. And again, everybody on the call, Jordan has said it many times. Carrington is not insurance. They are a company who promotes discounted savings plans for these services for their clients, such as In Touch Credit Union, on behalf of our members. So I just wanted to make sure I
Correct.
did that
W
again. And if
So
you,
one little thing about that too is, that brings up a good point, is what is the difference? Why should I go through the link that you have at In Touch rather than just go to the Carrington website? Number one, yes, that processing fee is cut in half. That's especially for In Touch Credit Union members. And second, this product bundling specifically with all of these products does not exist on the website. This was specially created for you all to be able to access and be different than anything you could find directly on Careington.com.
well, thank you for doing that for us, Jordan. Whether you did it whether you built it for us or someone else did, we definitely appreciate that because I was not a part of that conversation, but happy that the conversation happened. I'm gonna share. I did put the link in our website here, but just to show everybody on the call and for the recording, I want to um, share our screen so that they can find you guys through our website. So on our page here, which hopefully everybody can see, it's underneath the services tab and we didn't write Carrington. We typically don't use the name, the given name of our provider, but Carrington can actually be found right here under the ITCU care package. That is a dedicated link that will take members to the dedicated landing page for Carrington, and it will show you the plan pricing, what's all in there. There's a great FAQ section, uh, just and for login. So I just wanted to show everybody that real quick because there is so many services extra on our site and we try to get those out to everybody as possibly we can, but we also do want to ensure that we're giving equal opportunity to everything that we need to give attention to. So keep lookout on emails and our social media and our newsletters, because we do highlight providers like Carrington here, or announce new or upgrades or things like that. So Jordan, I don't see any other questions. We made really great on time. Uh, is there anything you would like to wrap up with on Carrington, and would you be the person if they called in? Are you like the sole ITCU rep, or for questions, or would they go to a team?
That's a great question. So we actually, if you do need to call Carrington for any reason, um, we do have direct lines to us on the sales team. If you need to call for a general question, though, the main Carrington hotline, which can be just found on Careington.com, or if you type in Carrington into Google, there are call centers that actually link directly with our employees here in Texas. So we do that all in house. You're not going to be transferred to someone random. You're going to be connected with someone with intimate knowledge of all of our products, how they work, how you get signed up, and how to specifically get signed up on this specific plan. If anyone does have any specific questions for me, Josh, feel free. You can share my information with anyone who requests it.
Awesome. Thank you, Jordan. If you guys have any specific questions, please feel free to send them to community@itcu.org. We'll get you in touch with Jordan. Uh, if you have any more specific questions, because we know sometimes maybe there are some really specific questions, but we don't want to air all knowledge on a webinar with people that we may necessarily not know. But we will get that over to him. And please continue to follow us on our social media, which is Facebook, Instagram, Twitter, and LinkedIn, and be on the lookout for the next upcoming webinars. We usually have at least one or two every month. Jordan, thank you again for taking time out of your day to speak with us, and more importantly, to speak with our members. And we will be in touch with you soon.
Beautiful. Josh, thank you so much for having me. I appreciate it so much, and everyone watching. Really appreciate it. And I hope you do take the time to learn more about us at Carrington.
Awesome. Thank you, sir. Thank you, everybody. Have a great day.
Thank you.